Thank you so much for joining me. It's my pleasure today to introduce you to a new segment of our conversation series, the Health Roundup, Health Matters and What It Means for You. This is a new segment that we're coming up with, and actually it's been formed by some of the earlier conversations and earlier projects that I worked on. And some of those projects started during the COVID-19 pandemic. And one of the key drivers at that particular moment was to ensure that people had access to the right healthcare information to be able to make informed decisions about taking care of their health, which was an important thing, and it still is an important component. And basically, one of the aspects that we noted at that particular moment was that most individuals were making decisions of their health with limited to no information. And to a greater extent as well, patients never had a critical stake, or rather, they had the stake, but they had never had much of a voice in how all the healthcare services they were consuming were being delivered, where they're being delivered, and whatever factors that were playing behind the scenes to ensure that those healthcare services were available for them. So if for us to be able to move beyond that, what need we want to do? At that moment, we focus on discussing emerging topics in healthcare to help them make sense to the patients and to the public, and most importantly, the consumers of the content that we are creating at that particular moment in time. At the moment, the key bit about it is still the same, but we're looking at it beyond the patient, beyond the public. Health matters, and what it means for you is about ensuring that you as a patient, you as a healthcare service provider, you as a service provider in terms of an institution or an organization or a company, or even the government for the public sector, deliver the healthcare services. You are informed of what dynamics and developments are in the industry, but as much as you understand these developments, you're also able to make an informed decision on what those particular nuances and interpretations could mean for you as a patient. Looking at it, for example, all of us are probable patients or even patients in the live moment, and as of now when we're talking and I'm doing this video. If David is unwell today, where will he get his healthcare services? Will I go to a clinic next to me? Will I go to a pharmacy? Will I go to a hospital? Which of the hospitals are available who would be able to intervene and offer me the healthcare services that I do need to be able to get better? Are they resourced enough? Do they have the right healthcare workforce? Those are some of the conversations that we need to know. But if David is not a patient and the person viewing you as my viewer is not a patient, move at it to the other side where you look at it as a healthcare service provider. I'm a pharmacist by practice. Assume as a pharmacist, I go to a government facility where I'm employed, or even a private hospital, and in that pharmacy where I'm hoping to treat you as my patient, the medicines are not available. What value will I be to you? And what can I do then to ensure that you're able to get the medicine when you come to the hospital? But if you're not able to, what interventions am I putting in place to ensure that if you do not get the medicines today, in a week's time or in a month's time, it will be available? As healthcare providers, how can we play an active role better to give the patients what they need? But on the other end, we understand that healthcare being a social services, there's a government responsibility to it. How do we get governments to invest and ensure that we're able to achieve universal healthcare coverage as an aspiration, but also as an imperative and a priority, as a need for the public? How do we get the government to invest? What are the key priorities for the government? What policy gaps do exist that they can shape to ensure that the policies are responsive to our needs and able to ensure that you have the healthcare services that you need? And on the other end, we also have to acknowledge that there are private sector players, the people who are buying clinics, investing in diagnostic services, the people who are manufacturing the medicines. All these are components of a healthcare service ecosystem. So the private player who is in that ecosystem, what does these developments mean to them? And what these developments mean to such kind of a person is important, because then they're able to make an informed decision on whether to invest or whether not to invest, which sectors to invest in and which sectors not to invest in. And once they make that informed decision, we are guaranteed that all the players in the ecosystem are able to make an informed decision. They're able to put in the right interventions where it needs to happen. And by doing that, we're able to guarantee that we are all working towards universal healthcare coverage. And if you're able to deliver on that, then we'll have met our objective to ensure that every individual, wherever they are, have access to the right quality healthcare services that they need. And investment in the healthcare services are sustainable and driving economic progress as we aspire for it. in that case, then we'll be successful. And I'm hoping you'll be geared to join me and to walk this journey with me and my colleagues as we develop this content and be able to make sense of the healthcare conversations that most oftentimes are never talked about, and also the things that are never looked at from one perspective or the other. We might not have 100% the facts, but we'll try as much as possible to dig into the facts, to present them in an objective way, but also to inform you on what action can you take. Because if you do not take the action, if we do not take the action, we might never achieve this mission, and we're counting on each of us to make this a success. Thank you, and let's engage in the next series of conversations.